building a better Bay Area for a safe and secure future. This is ABC 7 News.
Good afternoon, everyone. I'm Liz Kreutz in for Kristen Z today. Welcome to our daily program called Getting Answers. We're asking experts your questions every day at 3 to get answers for you in real time. Today, I'm going to share my conversation with the president of San Jose's Police Officer Association. They, along with San Francisco's police union, announced their plan for reform and a pledge to remove racist officers. We'll also get reaction to this plan from a local law professor. But first, some big news today with the FDA revoking emergency use of the drugs hydroxychloroquine and chloroquine to treat COVID-19. So what does this mean? That's what we want to dig into. So joining me to get answers is UCSF infectious disease specialist, Dr. Peter Chin Hong. Thank you for joining us. And remember, to all of you watching, you can always ask your questions in real time on Facebook Live and YouTube Live. So send us your questions right now about all of this and we'll get chatting. So good afternoon, Doctor. Thanks for joining us.
My pleasure, Liz. Thanks for having me on.
All right. So, Doctor, for people who are just joining us right now as they're starting to put their questions in, just tell us a little bit about what the FDA has announced today regarding hydroxychloroquine.
So I guess for many of us in the field, it's kind of about time. I think we were all kind of surprised that it got an EUA designation in the first place. EUA, emergency use authorization. It's kind of, you put that on a drug when you have enough evidence that the drug actually works. We never really had enough evidence. It was only in the test tube and a Petri dish that killed virus, but never in a human. And I think more than 3 studies now that haven't been revoked have actually shown that it just doesn't work.
It doesn't work. So how significant is this a change for the FDA to revoke this emergency use? Are you surprised by that?
I think we're not surprised by it. A lot of people in the scientific community are actually happy because it really is consistent with how we should be approving drugs under emergency use authorization. For example, the drug remdesivir, which was made by Gilead, as a result of the trials, was put on EUA, and that sequence of data, then EUA, was the way in which we expect that EUA designation to go. In the case of hydroxychloroquine and chloroquine, there was no data, there was the EUA designation, now there's data, so it was revoked.
We're getting a question in from one of our viewers who's saying, what were the side effects of hydroxychloroquine?
Yeah, so the side effects of hydroxychloroquine are mainly heart-related. So they were mainly rhythm problems that when people got put on the drug, they had. Particularly the sicker you were, the higher the chance that you'd have it. So in not as sick patients, maybe they had some problems, but they weren't as seen. In the hospital setting, we're monitoring patients very closely, and the studies where the patients were hospitalized, they noticed that in one of the studies, for example, published in the British Medical Journal, there was about a 10% chance of having a heart problem if you were put on hydroxychloroquine for COVID.
Interesting. And, you know, for people who already were prescribed this and now they're hearing that it's being, you know, the FDA is removing its, emergency use, what would you tell them? Should they be concerned?
I would say that if you're in the middle of a course, I'm always one for completing the course. I mean, I'm not saying that there is no chance in any setting that it does work, but the evidence so far in the settings that we use for treatment doesn't seem so. But if you're under supervision of somebody and already in the middle of the course, I would say just finish it. If you've had problems, of course, the risk-benefit calculus would suggest that you stop it. And if you're just about to start it, I would say probably don't go through with it or talk to the person who prescribed it to you, because there's really less evidence and it may cause you some harm.
You know, this might seem like an elementary question, but what exactly is hydroxychloroquine?
Yeah, so it's a drug that's not an antiviral. So that's why from the first pass, it's probably unlikely to work. We've never had a virus treated by something that's not an antivirus drug. For example, if you're taking a Tamiflu, it's an antiviral drug that actually targets the life cycle of the virus for influenza. When you're taking an HIV drug, those are all anti-HIV drugs that target very specifically something about the HIV ability to propagate itself. So when you look at hydroxychloroquine, it has nothing to do with an antiviral drug. It was developed first as a malarial drug, and then it's most commonly used in the United States for rheumatoid arthritis. So it's what we call an anti-metabolite drug. It actually sort of interferes with the response of the immune system, which is very active in conditions like rheumatoid arthritis, to kind of quiet it down. So it really doesn't make sense that you use something that's not for a virus for a virus.
Right. And what does it mean, though, to remove it from emergency use? And will doctors still be able to prescribe it?
Yeah, totally. Because doctors will still be able to prescribe it, but it will be off-label. But it is protected for doctors to prescribe off-label because it's FDA approved for rheumatoid arthritis. I would say what it means in EUA is both a symbolic and a practical, operational, has operational implications, meaning that once the FDA designated it as EUA, what happened was that the drug companies and other people donated a lot of stores for what we call the emergency use, or the national stockpile. That means that in cases of emergency, the government can actually release a bunch of drugs to states that need it. And that's what's happening with remdesivir right now. In the case of hydroxychloroquine, for example, they released a bunch to Florida, and it's kind of like sitting in the Florida's public health group, and people don't know what to do with it. But that's what EUA does. It allows the government to release things kind of from donations and stockpiles, like kind of an emergency use situation, which doesn't really fit in where we think this drug should be positioned from a medical perspective.
That makes sense. We're getting a lot of questions from people really about a vaccine. When is there going to be a treatment for COVID-19? What's your thoughts on that?
I mean, I think overall, I'm kind of optimistic. The vaccine work is going much faster than people think. But on the other hand, it's not going to be tomorrow. It's probably not even going to be January 2021, but probably in the spring, we will probably have enough of the most promising one to treat a group of patients with, or a group of people in the public with. Of course, some of the front runners are being funded by the US government. It's called Operation Warp Speed, and I think they've designated, 5 people or 5 groups that they have the most promise, and some of them include a group from Oxford, a group from Boston, that's Moderna. There's a collaboration with Pfizer in Germany. So some of these companies are getting additional funding, and you notice there's a combination usually of a lab where they develop the vaccine and a pharma company which has the infrastructure to deliver the vaccine. And then again, the funds from the government are meant to sort of accelerate that delivery. So in terms of the ones that are furthest along, the one in Oxford, for example, is in phase 3, and which means that they're going to test thousands of people soon, in a month or two. And the initial evidence from some of the early vaccine groups, like the one in Boston and one in England, they've shown that they could, when you give it to somebody, in a small group of people, you can develop the good antibodies that we hope would then protect people against getting COVID. But of course, we don't know who's getting protection against COVID yet, because that's not the phase that the vaccine is being studied in yet.
Right, absolutely. Really quick, because I think we got to wrap up, and maybe we'll continue.
Right.
Do we have to wrap up, or can we continue a little bit right now? Okay, we're going to continue, Doctor, on our live stream. We have a lot of questions we want to get to, but we're going to just take a quick break right now here on TV. Again, we've covered COVID, so now we're going to move on to look at police reform when we get back. 2 local unions announced changes that they want adopted nationwide. So we're going to hear from the president of San Jose's Police Officer Association about this and defunding. But I want to thank Dr. Chin Hung from UCSF for that, and we're going to continue our conversation right now online. Stick with us. We'll be right back. All right, Doctor, thank you. We're back to talk about our questions. I think one of the questions we got was, is that vaccine, when it becomes available, is it going to be available like the flu shot is available?
Yeah, so I think what will happen initially is, first of all, which is generally kind of country by country. Each country will decide of the front runners which vaccine they want to choose after it shows data showing that it's effective. And then the government will have to say, okay, who's going to be the first people to get it? Because not everybody can get it at the same time. But that process to get it to everyone, to most people, is probably going to be not too slow once it's approved. And the process will be, yeah, just like getting the flu shot. Initially, probably there'll be mass campaigns and there'll be lots of availability, and will hopefully fit in where people's lives are. So if, I can imagine, for example, distributions at hospitals and tents and Walgreens. I mean, they'll be probably using a bunch of different places to get it to people as fast as possible.
And someone I think is just asking us your prediction on when the shelter-in-place order is going to be lifted. I'm guessing you might say probably not till we get that vaccine.
I know. I wish it could be better. I mean, I think what we're seeing is that people are lifting various levels of shelter-in-place in different parts of the state, and I think that's more confusing to people than when we used to do everything the same way. But I think it's just a matter of trying something out and looking at the numbers and then scaling back if it looks too high. For example, there's talk already in Arizona of being a little bit more restrictive because they're kind of reaching hospital capacity now.
Absolutely. All right, I'm getting the wrap. So I want to thank you so much for joining us. I've heard you've been on before with Kristen, and you're really wonderful at this. So we hope to have you on again soon. Thanks so much, and we'll talk to you soon.
Yeah, you've been great, Liz. Thank you.
Thanks. Bye. All right, welcome back. We heard from police unions over the weekend after calls to defund and reform the police. So we're going to address both of those right now. As far as reform, here are some of the plan by 3 California police unions. San Jose and San Francisco's police officer associations, along with the LA Protective League, promised to create a national database of former officers fired for gross misconduct, a use of force standard emphasizing de-escalation, ongoing crisis intervention for police officers, and a publicly accessible website of use of force analysis. That all came with a statement saying that it's an important step toward improving police and community outcomes. So I talked with Paul Kelly, he's the president of San Jose's Police Officer Association, about this and the idea of defunding the police. My first question, though, was how will this pledge really root out racist officers?
Well, I think as we listen in Washington, D.C. about police reform, and we hear politicians talk, attorneys, so-called experts, I think what's important is let's not forget the rank and file. Who needs to be at the table is association leaders across the nation to talk about these serious discussions and policies, especially if we're going to make it a national policy.
So what changes, if any, are going to be made to how officers are trained?
Well, I think training is key. If you talk to any officer, they always want more training. For example, just to qualify with a gun in some agencies, you only have to shoot and qualify once a year. That's ridiculous. When you talk about de-escalation tactics, when you talk about dealing with the mentally ill, some get 10 hours of training. That's it. 40 hours of training in the academy. So training is a huge component of what we're talking about, in combination with the policies and good, solid, concrete policies that, number one, keep officers safe and the community safe. If you have those 2 items, then we should put it on the table and talk about it.
So as you know, there's a lot of talk right now about defunding the police or reimagining the police and potentially taking some of the funds from police departments and instead investing that money in community programs. Do you believe that there's any value to that idea, that it could, as some believe, help stop crime in the long term?
Well, I would say this. If you need money in communities of color for all of those reasons, education, job, the youth, but defunding is going to hurt those communities. Calls for service will rise. There'll be less officers, less training, all the things that our community wants us to do, to be better, to respond faster, to have better training. You start talking about defunding, you're actually taking that away. So it doesn't help anybody. It doesn't help the cops, and it sure doesn't help the communities they serve.
So, there's going to be people saying this in our conversation right now and saying we've seen reforms before, nothing's changed before, and they're going to question how these changes are going to be any different. What do you say to that?
I think it's a valid question. because when horrific incidents happen, like it happened to George Floyd, everybody wants to talk about it and start having an opinion, being symbolic somehow. What I'm saying, what LA's saying, San Francisco, and many other associations across the nation is, let's do it. Let's not just sit at a table and keep talking about it for the next 2 or 3 years. Let's do it. Let's get policy in place that's good. Let's get the training and get the funding to do both of those things.
Last question for you. Of the reforms announced today, which do you think will be most significant in really making change?
Well, you know, they're all kind of tied together. I would say that when you start talking about a national use of force policy, doesn't quite get bigger than that. But with that, you really have to have the other items, early warning system, the training, databases local on websites for people to access all the use of force in their own city. You really got to have all those components.
When you talk actually about that database, is there a commitment then to not hire those officers once they get put into that database?
Well, I think the commitment should be if there's an officer that's fired for something horrific, gross misconduct, and we have to figure out what that is, right? Then they shouldn't be a police officer anywhere. I don't think there's a police officer in this country that wants someone on their force watching their back if they did something horrific and got fired for it.
All right, so that was the president of the San Jose Police Officers Association there. You've heard now from a local police officers association, so we're going to get reaction now when we get back. Let's just take a quick break on air. We will continue this conversation on our live stream, including abc7news.com. Stick with us for that reaction. All right, guys, watching on Facebook Live. Hope you guys are doing well. I'm just going to bring it up here so I can see what you guys are all saying. I don't have it up. Stand by. So, Governor Newsom gave his first briefing in about a week. You know, he was doing those daily Newsoms at noons every day for the past few months, and he sort of stopped those, and now he's just sort of coming on every few days or every week to give an update as things go. And a big question was this idea of, are we moving too fast as a state right now? Cases are going up, but across the country, as we heard the doctor talk about, right, specifically in places like Arizona. But, you know, Newsom really, this was his argument for why we're not moving too fast. A, that it's local. You know, counties can make their own local decisions. So if counties don't feel like they're ready locally, then counties don't need to reopen, even if the state has set a standard where they could reopen. He also said that things are pretty stable when it comes to hospitalizations. Those are stable in the state. ICU rates, those are stable. Positivity rates, stable. The spread is stable. So because there's stability, there isn't this sense that cases are going so high up that we're going to overrun the healthcare system. They're pretty confident that even if cases were to rise to a certain amount right now, that we'd have enough hospital beds to deal with that. And so because there's that stability, that's why the governor feels safe for us to start reopening a little more. But again, it does not mean that the virus has gone away. Stability does not mean it's gone. It is still there. It's still spreading. It's just not spreading at, you know, kind of one of those crazy alarming rates like we thought it could in the beginning if we didn't implement the shelter-in-place order. So hope you're all staying safe out there. I know it's tough. It's been tough on me too as we enter the summer and want to get out and about. But here we are. All right, stick with us. We're about to come back on air. All right, welcome back. We started getting more into what defunding police means last week and over the weekend. San Jose and San Francisco police unions came out with new reform policies. So now what, right? ABC7 News anchor Reggie Akey had a really interesting conversation about all this with Santa Clara University criminal law professor W. David Ball. He wanted to share this with you. We all do. So take a listen.
So, Professor Ball, we've been hearing a lot about this call from protesters to defund the police. And there's been just about every definition you can think of when it comes to what defunding means. And we are seeing some police chiefs and mayors respond to it, and others here in the Bay Area, not so much. So where are you seeing this trend going right now?
Well, it really started with Angela Davis and Ruth Wilson Gilmore and sort of calls. I think the best way to understand it is a reorientation away from using police as being the sole first responders for all social problems and really trying to talk about funding the things that that would ameliorate, or that would help at the root cause of what causes people to be violent or to use substances or things like that. So there is no accepted definition. This is a movement, but I think it's the fundamental premise is, let's shrink the footprint of the police and actually fund some things that would be more helpful, like homelessness or drug treatment or things like that.
And of course, that brings into mind a lot of questions about how exactly that would work. So, for example, in San Francisco, the mayor has said that she only wants police going on calls where a crime may have been committed, which would, we assume, take out calls that could apply to homeless camps or even someone who's having a mental health crisis on the streets. And the question is, so who does respond to those calls?
Yeah, I mean, this is really where it needs to be worked out a little bit more. And that those are the right questions to be asking right now. I think maybe one thing that I might say is that our conception of what the police are has not been fixed at any point in human history, right? At any point in the United States history. So we didn't have professional police until the 1830s, and Boston was the first place. And what their jobs were and what our theories about what police do has changed over time. So in some ways, this is just a return to those kinds of questions about what we want police to do. But you're right. If I, as a citizen, call in, how do I know if this person's having a mental health crisis, or they're on, having a substance use problem or whatever? And those are the kinds of things that I think we'll need to iterate and experiment with. That's maybe the good thing about the fact that most police are done at the municipal level, because we can have different cities doing different things and learning from each other about them.
And we are hearing now from police unions, including in San Francisco, and they have responded and they have said that, okay, well, we do need to do something. They don't believe necessarily, of course, in defunding the police, because that goes against their own interests. But they seem to be at least giving some ground there that there has to be some reform, including putting out lists of cops who have had a history of problems, so that they are now in a national database. That does seem like a possible step forward.
It is a step forward. What's frustrating is that, why have we not had this for so long? And the answer is, those same police unions have fought that, right? If an officer is convicted of a felony, why on earth should we make it hard for someone to find that out? Why on earth should anyone ever rehire that police officer? And so, of course, those are great starting points, but those were the starting points that movement people wanted 10 or 15 years ago. And so now the question is, why so little, why so late? And what more can we actually do that's going to actually work out best for everybody? I mean, I think that's one other thing that's missing, is that are police working for everyone in the way we want them to? Right? Are they actually making all communities feel safer? I think if I were an African-American in Minneapolis or San Francisco or Atlanta, I might feel like calling the police is not actually going to help me. So I would like us to make sure that when we do have police, that everyone feels safer when they are on the scene.
We'll be watching it closely, and it gives you plenty to talk about.
Well, yeah, and I think the one other thing I want to say is that I'm glad that you're asking questions about the sort of blocking and tackling and the implementation issues here, because I think it's one thing to sort of have splashy conversations about what should the police look like, and it's another thing to sort of devote the resources and time and attention to the sort of boring but extremely important parts of how we implement new policies. And that, I think, is really maybe where I come down as a law professor. It really is the devil is always going to be in the details. And that's going to take sustained effort, and it's going to take intense concentration, and it's going to take back and forth about things that might seem very, very small, but which are really important, right? So how easy is it to fire police officers who've committed, violent acts against citizens? Those are details in contract negotiations that take place at the municipal level. And that's not typically something that someone rallies around and says, hey, let's go to a budget hearing at the city council meeting. But going to a budget hearing at the city council meeting is where we're going to find out just how much the police are going to be reformed and how much some of these changes are actually going to be able to be implemented.
A really interesting conversation, and I love his bookshelf behind him, too. All right, we're taking a break now on air, but the conversation, of course, will continue on our live streams, including Facebook Live right now. And when we come back, we're going to have Dr. Alok Patel with us to talk about beating quarantine fatigue. Stick with us. All right, guys, on Facebook, we wanted to give you some extra content right now. So here's what it's looking like in San Francisco today as customers are now allowed to shop inside stores. This is ABC 7 News reporter Amy Hollyfield.
Heidi Sablehouse-Myers spent the morning getting her San Francisco boutique, Heidi Says, ready to welcome customers inside for the first time since March.
We're very happy to see our customers and just for them to finally come in and feel fabrics and look at the clothing in person.
She's surprised retail had to shut down this long, especially since large retailers like Target were allowed to be open.
I was expecting to open in the beginning of June. I thought at that time that was that felt like the right time. So I was hopeful. And then whenever we had another couple weeks, it was hard.
I'm so happy for the retailers, and I hope this increases business for them.
Shopper Rachel Mole says she will likely visit shops again in her neighborhood, but we also heard some hesitation from residents strolling Fillmore Street this morning.
I wouldn't do it until we have a vaccine. That's how strongly I feel about it, and mainly because you just don't know if you're carrying.
I already do a lot of online shopping. I'm probably gonna stick to that. Yeah.
Why?
I don't think it's safe yet.
Heidi has a safety plan in place. She says she will wipe down surfaces, provide a touchless checkout, provide masks, and also sanitize the dressing room experience.
We have a process for trying on. We're going to steam the clothes, put them aside, anything that has been tried on and not taken home. We've had a lot of conversations about just overall safety in the store, how we're opening thoughtfully.
All right, I don't know if you guys have gone shopping yet. I just did this weekend yesterday. I was in Healdsburg and I felt pretty safe. Everybody was kind of keeping their distance and, we're kind of getting the hang of it. Really kind of crazy how we can adapt so fast, right? All right, so stick with us. We're about to come back on the air. Stay by. All right, we are now back and able to bring you even more content now that we have this platform at 3 o'clock every day. And that means we get more from our social correspondent, or special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts. And every day he's going to talk directly to you in a segment that we're calling Doctor's Note.
My name is Dr. Alok Patel. I'm losing track of what day it is. We've been sheltered in place for months, and I, like many others, have quarantine fatigue. But sadly, statistics and data are reminding us that we're still very much in the first wave of this pandemic. Yes, on today's Doctor's Note, I'm going to be the fun police. In the very beginning, people were asking, is it safe to fly, visit friends, or go to a restaurant? And then in April and May, everybody was freaked out and doing everything they could to follow all the public health guidelines. Fast forward to today, and people are once again asking if they can push the boundaries, attend house parties, go to weddings, or have a beach party. What's happening is people are experiencing quarantine fatigue. That fight or flight response that had people focusing on safety guidelines is wearing off. But we can't let our guard down. Even though businesses are reopening and you aren't seeing the same type of images on the news, it doesn't mean the COVID-19 threat has subsided. It's still very real. We just passed 2 million cases and 116,000 deaths in the United States. And there are predictions we could see another 100,000 deaths by fall if we aren't careful. And then look at right now. According to the COVID Tracking Project, since Memorial Day, cases have gone up in over 20 states. The virus is hitting states in the South and Southwest particularly hard, including my home state, Arizona. And there's no one reason behind all this. It's likely a combination of lifted restrictions, increased testing, more social gatherings, and people not following those guidelines as strictly. But we have to stay vigilant and fight the quarantine burnout. It's hard, I know, we're social creatures. Everyone's over it. But we have to shift our mindset and remind ourselves why we're following such measures. So keep washing your hands, keep wearing those masks, and physically distance whenever you can. Instead of focusing on what we're all losing, let's try to think about what we're gonna gain and how many lives we're gonna save if we stay strong. Oh, and lastly, if anyone has any show or movie recommendations, please hit me up on social media. Thank you.
Same here, please. I feel like I've watched all of Netflix, but I am watching Killing Eve right now on Hulu. That was recommended, and it is very good. Sandra Oh. All right, thanks so much for joining us on this interactive show. We got answers from Dr. Peter Chin-Hung about why the FDA is revoking emergency use of the drugs hydroxychloroquine and chloroquine to treat COVID-19. We also heard from a local police union about their national reform plan. We'll be here every day at 3 on air and on our live stream answering your questions. Have a great day.